Yeah, you want me to do, Manju?
Is that okay? Thank you.
All right.
All right. Thanks everybody for being here today. So we're going to do the session on CPR. So let's start my share screen. Can you see my slide? Yeah.
Yep.
Okay, that's good. So this is TAE DEL 401, so group presentation. I'm going to do on, this is a unit of competency, which is provide cardiopulmonary resuscitation. All right.
Yep.
I'm just gonna put this over here because this is covering my slide altogether. Okay. So I'm sure you've all done CPR as a training session for your work or for your studies or things like that. So maybe it's a bit of refresher for you, or just refresher for all of us, I guess. So how long ago did you do the CPR course?
Me last year.
Oh, okay. Yeah.
Me too.
Yeah.
Last year.
Okay.
I have done 5 years back.
All right.
Every year we have to update.
Yeah. So are you from nursing background, Cecil?
Yeah, I'm from pathology.
All right. So we've got some from nursing, some from child protection.
Yeah,
is it child protection? Yeah. So in this topic, I'm just going to focus on CPR, but not the defibrillator. Just hands-on CPR on this topic. Yeah. All right. Just to start with, what do you think cardiopulmonary resuscitation means?
to resuscitate heart.
Yeah, that's right. So cardiopulmonary resuscitation, this has got, as you can see, 3 words together. So cardio means heart. Pulmonary means
lungs,
and resuscitation means restoration of the life. All right, I think I need help with somebody else because I'm getting this people as in line, and it's quite obstructing of my PowerPoint, like my slide.
Yeah.
Drag it to other side.
Time to time you need to change the position.
Yeah, it's coming as a horizontal, not like a vertical. So that's why it's so not comfortable. Okay, well, sorry, I am still struggling a little bit. Still not good.
Yep.
Okay, well, that probably be better than nothing. Okay, yeah, that's right. So cardiopulmonary resuscitation, that's a lungs, that's a heart, lungs, it's resuscitation, bringing back to life. All right. So in this session, my learning outcome will be recognize what cardiac arrest is and demonstration of proper positioning for CPR, and then explaining how to perform the CPR. Not organized at all. Sorry. Just gonna put the timer on as well. Okay, good. Okay, so to start with, I just want to discuss what cardiac arrest is. Now, can any of you tell me what if cardiac arrest and heart attack, is it the same thing?
Not the same thing.
No.
Yeah. So how does it different?
Heart attack means when the blood flow doesn't go to the heart, then it's called the heart attack.
Yeah.
And the cardiac arrest means don't know.
When heart stop pumping, it's cardiac arrest. Like heart is not moving, and as a muscles, like it's not contracting. And heart attack is like the blood supply around the heart. When it stops, there is not sufficient blood supply to heart. Then it leads to heart attack.
Yeah, that's exactly right. So cardiac arrest is when the heart stops pumping. There's no signs of life. You're unconscious. You're just unresponsive, and it may be due to heart attack, or it may be due to a few different other reasons. But when it's heart attack is when the coronary arteries of the heart is not giving blood supply to the heart, and that's the primary reason that you're not getting blood supply to the heart. But not all the heart attack can go to cardiac arrest. Some of them do, some of them don't. But people get a bit confused that heart attack and cardiac arrest, whether that's the same thing, but it is not. So in CPR, that when we give CPR is when the people is on like have cardiac arrest. So I've got few checklists, a few lists here. So when heart stop pumping, when there's no signs of life, when the person is unconscious, and when person is unresponsive, so not breathing or not breathing normally. So what do you think that means, not breathing or not breathing normally?
Not breathing normally?
Yeah. So some people like kind of have this noise of breathing, which is not normal. You know, now we're breathing nice and steady. It's like a regular. Some people breathe like that. Yeah. So that's not normal. So that means that's cardiac arrest. You should start CPR on. And heart attack basically is it's just not supplying enough blood to the heart muscle. Now, with CPR, I just want to talk a little bit more about, are you legally obligated to provide CPR?
Yes. Me as a physio, I can.
I'm sorry, I've got a bit of cough as well. Actually, no.
As per my understanding, oh, is it?
Yeah, it's very strange, isn't it? You are not legally obligated to provide CPR.
Why?
But at my workplace, like I have seen some of the registered nursing, like I have literally seen a resident, like she was in cardiac arrest and the RN immediately just gave her like CPR.
Yeah, so that's different because you're at work. So it's your duty of care because you're at work.
Oh, yeah.
Yeah, when you're at work, that's your job. You've got to do it. You are legally, obligated to perform CPR to bring people back to life. Yeah. But if you're a bystander at the road, you are not legally obligated. But that's morally, right. But morally, you can't go back home thinking that, oh my God, I could have saved this person's life. I could have done this, but I didn't. You know, you will feel so bad about it.
Can I ask, Manju, what if you already have like a certification for first aid training?
Yeah.
And you are able to do that?
Yeah.
Is it still not legally binding?
Apparently not. I find that quite strange as well. Apparently you're not legally bound to do the CPR. But saying that, everybody jumps on people, I guess, like, helping to bring people back to life. But in Northern Territory, you are legally obligated to do CPR. If you don't, then you can go to the court and you have to justify yourself why you didn't do it. But elsewhere, other than Northern Territory, you are not. Yeah, it's very strange, isn't it? Yeah, for example, like if at work, you are, but if you finish your work, if you come out, you went for, coffee or something, you went and there's something happened there. Again, you are, because it's out of your duty hours, you're not apparently legally required to do that. But as I explained, sorry?
We will make sure in future.
But I'm not saying that not to do it. But what I'm saying is you won't be able to go home and
Exactly, we can't leave the person as well.
No.
Yeah, we need to call 000.
That's right. You won't feel good about yourself. Yeah. Morally, it's
who are legally obliged.
Sorry?
To do it. So who are legally allowed to do it?
I'm not saying allowed. You should. It's not about allowed. Everyone can do CPR.
Morally we can, but I mean, so like if there is anyone having a heart attack on the roadside.
Yeah.
So I think when you are out of work, like when somebody needs CPR, but you need to first call 000, and if they will give the instructions, then you can give the CPR. That's what my understanding is. But because that time the emergency department, that person like who is providing you all the instructions how to deal with the situation, I think if he or she will say like you need to start CPR until the help will arrive, I think that in that time you are obligated because you got the permission from the authority, that person on that time. Because otherwise if you will wait for the ambulance to arrive or emergency department to arrive for 10 minutes, the person will gone.
Yeah, so the main thing is CPR, AD, the defibrillation is not hard. Anyone can do it. Anyone can do it. Anyone can. You don't have to wait for the emergency people to, ambulance people to say that or start CPR. You can just start. You can just start doing CPR straight away because it's not a hard thing to do, and you can actually save somebody's life doing CPR. What I was saying is legally, if you don't do it, you're not going to be, you're not going to have to face court. But it's a very simple thing to do, and everyone should do it.
Yeah.
You don't have to wait for somebody else in instruction to do the CPR.
So, but if something goes wrong while doing the CPR,
yeah. If something goes wrong, then it's not your fault because that person is dying anyway.
Oh my God.
I'm sorry, it sounds so not nice, is it? Yeah, so that's the fear, that's a fear in the general community that, oh my God, I'm not going to do CPR, that what if something goes wrong? And that's my thing. If things goes wrong, it goes wrong. But all you can do is try and help somebody and save their life. That's all you can do. All right, interesting. All right, let's go to the what causes the cardiac arrest. So this is the disruption in the heart rhythm. It can cardiac arrest can be due to drugs or poisoning, and we've already said it can be because of the heart disease, heart attack, and that's probably 70% of the times cardiac arrest happens because of the heart attack. And traumatic injuries, lots of blood loss, and anaphylaxis as well. Any questions on this?
What is anaphylaxis?
Anaphylaxis is the reactions. For example, you're allergic to nuts, you have nuts and you get anaphylaxis. That's like shutting off the respiratory tract and you're not going to be able to breathe.
Okay.
Yeah. So cardiac arrest means your heart suddenly stops pumping, your blood supply to the brain is not working, your lungs are not working, and then you're collapsed. So anaphylaxis, your respiration tract got closed, then you can't breathe, you can't get oxygen, then you had cardiac arrest.
So that's the trigger points for the cardiac arrest.
Yeah. Sorry?
It's a trigger point called the cardiac arrest.
Sorry, I'm getting actually quite, I can't hear you, Nixon.
So is it a trigger point to cause
for cardiac arrest? Cardiac arrest is a whole different, very, very big session. Cardiac arrest, cardiac arrest, yeah. So trigger point for cardiac arrest, as I said, these are the things. Heart attack, what heart attack does, it doesn't give blood supply to the heart. And when there's a not demand supply rate, I'm actually got quite disturbances. When there's a demand supply not made, and then your heart goes to the funny rhythm, which we call in the medical term is a CVF. Sorry, I'm getting a bit of background noise. Yeah. And then we get this. So when that happens, and then heart suddenly stops beating. Is that does it answer your question, Nixon?
Yeah, I think I understand.
Yeah. Okay. Now, so in Australia, there's a resus.org.au, and that gives you lots and lots of information about this cardiac arrest and the resuscitation thing. So the main thing I want to talk about is the chain of survival. This sounds a little bit confusing, but you can see there's 4 different circles. Number 1 is early recognition and call for help. What do you think that is? So basically,
Like if you are looking for
You recognize.
it's good to call for help first.
that's right.
If you feel any symptoms, and then you just it's early recognition, and then you call for help.
That's right. The early you can get for help, the higher chances of survival.
Yeah.
Yeah. So that's the reason that people who have cardiac arrest in hospital have higher chances of survival than people who have cardiac arrest outside the hospital, because the time the medical, the ambulance, the people need to get there, and it prolongs the time, and the chances of survival gets less.
Yeah.
Second circle is early CPR. So early CPR, as soon as you know that this person had a cardiac arrest, then you start CPR, and then this is actually buying time until the definitive treatment actually comes, the help comes to save this person's life. So that's one of the reasons that you actually need to know whether this person had cardiac arrest or not. So if you can find this person has a cardiac arrest, then you can call for help quicker. So then you can save this person's life. And as soon as you know, okay, this person has a cardiac arrest, then you start on CPR straight away, and then you are again helping to save this person's life. The next step is early defibrillation, which is a defibrillator machine, which I'm going to discuss in next session, is electrical shock to bring patient back to life. Normally in cardiac arrest, the heart is going to this funny rhythm, and defibrillation stops all the funny rhythms and helps person's heart to take back control on the normal rhythm. So if you get early defibrillation, there's another chances of bringing patients back to life early. And the last thing is post-resuscitation care, which is, so now the person is back to life. Now the person is breathing normally and heart's beating normally, and then you need to care the patient to find out why this patient had a cardiac arrest in the first place, so this person doesn't go back to cardiac arrest again. So this is a chain of survival in these 4 different circles. Any questions on this? This is a very big topic. But yeah, I want to ask, do you know what happens with CPR when we do a compression? What happens to the heart?
Like blood supply to, like we will just compress the heart between like the 2 bones, and then blood supply, there are chances to improve the blood supply to heart, and that helps to prevent the cardiac arrest.
Yeah, so what happens is our heart normally pumps, in a 60 to 100 beats per minute or something. It normally pumps. What happens in cardiac arrest? It suddenly stops. So there's no blood circulation happening. And when you're actually compressing it, then you're actually mimicking as a heart pumping. So that means that your circulation of the blood is still happening. So it's going to go to your brain, your kidneys, your liver, all the important organs. So that's why it says to buy time, means that you're actually compressing it as a artificial heart pumping. So your other organs are still alive. What happens if the blood doesn't go to the brain for 3 to 4 minutes? It's going to die. And it's probably like not good, I've seen a lot of cases in the hospital, like prolonged CPR, like long CPR, and the supply to the brain is quite like not very efficient, and they do survive. We have some, I'm not sure how many percentage, but people who survive after long CPR have lots of memory issues, cognitive issues, and things like that. So that's what CPR, you are actually pumping the heart artificially to supply the blood to all the organs. Okay, any questions?
No, all good.
All right, I just want to show you this the chart. So this one shows that here is 0 minute. So this is when the can you see my arrow?
Yep.
Yeah. So this is when the cardiac arrest happens. So as soon as the person's had cardiac arrest happens, the survival chances that you've got is 50%. And it slowly decreases as per minute. Every minute of not getting CPR, you're losing 10% of your chances of being survival. So every minute is 10% less chance. So this line here, oops, what did I do? As you can see, I'm probably not very good in the computers. So this line is no CPR. Then you've got about 8 minutes. This person will die. With the CPR only, then you've got about 12 minutes. That basically means you have extra 4 minutes. And hopefully by this time, you'll get the defibrillation or you got the medical help. Then by this time, if they got defibrillation, they've got chance of survival. So what basically this shows is even only CPR can give you prolong your chances of survival for about extra 4 minutes. So you're actually buying the time until the definitive treatment comes. Okay. So any questions on this? Yeah. So this is a flow chart, and I got this from the resource.org as well. Have you seen this flow chart? Yeah.
Yeah.
I think it's every institute.
Yeah, doctor as ABCD. Yeah.
ABCD, yeah. What about you, Nixon? Do you have in your workplace as well?
Yes.
No, not even doctor's ABCD. I haven't seen it.
You haven't? Okay. When I first started nursing, it used to be Doctor ABCD. And now they put S as a send for help, which is the most important thing. So it's doctor's ABCD. And it's quite self-explanatory. D for danger. R for responsiveness, checking for response. S for send for help. A, open airway. B, normal breathing or not, checking for that. And C, start compression. And D, defibrillation. So on this session, we're not going to go with D, but we're going to go to doctor's ABC. Okay. Let's do danger. So what can you think of danger? Some people have, like this person has cardiac arrest. What are the dangers you can think of?
Surroundings.
Yeah.
Like any furniture, any like sharp objects. If it's a car accident, like fire.
Yeah, exactly. So you need to look after yourself first. I always say that. You need to look after yourself first, because if you get victimized, then you're not going to be able to help other people. So you need to look for danger. It's not danger for yourself. It's not danger for the victim. It's not danger for other people, especially now this COVID situation happening around the world. So if this patient had cardiac arrest, then you want to make sure that you're actually fully protected before you do the resuscitation. So that's why it's considered PPE, personal protective equipment. Check for if any fire, electricity, water is another hazard. So we need to look for the hazard in this slide. Yeah. So response. How do you check for response?
Do we need to call the person first, or we can check the breathe out of the, like, are you okay? Are you okay? If he's responding, that's okay. That's a good sign.
That's
if not, then we can check the breathe.
Yeah, so our response is you just call out the people, call out the person's name, or hello, can you hear me? Can you hear me? Open your eyes, can you hear me? Just yell out like that. If there's no responsive, then you go straight to send for help, because you know that this person's not responsive, this person's not breathing, then straight away you send for help. So what are the things in your place for send for help? Do you straight call ambulance, or is there any other buttons that you can activate or anything?
Yeah, we got the Met call number. That's 4222. It's like a Met call number.
Yeah, sure. So in the hospital,
first we need to call someone else. If you are helping the patient and you are going to call, you can't do everything together at the same time. You need to call someone else. So who is making a call for you?
exactly. That's very good point, because you won't be able to do everything on your own, because this is a very exhausting situation.
Yeah, it's really it's stressful situation. So we need to call help from other person who can make the call, and then only you can look after other things.
That's right. So shout out for help, activate any emergency buttons are there, call 000. If someone else can call 000 for you.
Yeah.
All right, straight away, next one you're gonna go is airway. Yeah. So they say the tongue is a major obstruction, and I've got a picture here when person's lying on the straight on his back, the tongue is actually obstructing the airway. So in other picture, just a little bit of head tilt, and then the tongue is out of the way. There's a huge topic on airway itself, but I'm not gonna go on airway today. And breathing is another line on the doctor's ABCD. So breathing, you do just assess for normal breathing. Look, listen, and feel. Look whether this person's chest is rising on breathing. Listen whether you can hear a breathing sound, and feel whether this person can breathing. So all these doctors doctors AB shouldn't take too long, because the main point is we should go on compression straight. All right. Has anybody done compression before? What about during the practice?
Yeah. Just to.
Yeah, that's right. So compression, CPR, as I already said, that's actually mimicking as a heart pumping as an artificial one. So the important thing is when this person is had a cardiac arrest, then the compression technique is like this. You can see the hands straight and interlocking like that. So this is the interlocking hands like this. And where should you put the hand? Middle of the chest, lower part of the breast, the central of the bone, which we said you can feel when you feel it, it's a lower part of the chest bone. And positioning. Now, if the victim is on the mattress, spongy mattress, it's not going to work. So the floor has to be hard surface. So you probably need to drag them out and put this person in the hard surface. Patient should always lie on the back. And so can you see the straight arm of this person in my picture? So that's how it should be. Straight arm. So the pressure, when you do the CPR, the pressure should be on the shoulder. So that's why interlocking, straight arm, and the pressure should be coming from the shoulder directly over the chest. So you're not going to hurt your back. It's not an easy job, as I said. Is there any question on this? Okay. And compression.
No.
So compression is 30:2. What that means is 30 compressions and 2 breaths. So I've written here rate 100 to 120 per minute, because our heart normally goes from 60 to 100 is the normal rates per minute, and that's how it should be 100 to 120 per minute, which basically means every second it has to be 2 compressions. And how deep do you go is 1/3 of the deep, minimum of 5 centimeters. Now I've written here uninterrupted CPR. What do you think that means?
Continuously.
They have to keep doing it for a couple.
Don't stop. Keep
Couple
going.
Yeah.
Until
Without
the
stopping,
person will receive his breathing person, like start self-breathing like here.
What happens if you're on your own and you're doing the compression? There's no one. So do you stop the compression to go and to give the breathing? No.
No.
Because breathing, again, breathing is your choice. because it's a bystander. Some people don't want to do the mouth-to-mouth resuscitation. You're not feel. I probably won't be comfortable doing mouth-to-mouth resuscitation on somebody that I don't know. So what these days they're saying, the research show that uninterrupted CPR alone without the breath is as effective as compression plus the breath.
Okay.
So, yeah, and another example of uninterrupted CPR is now the defibrillation is here, that you're going to put the pad on, but you don't stop compression while they put the pad on. You continue to do the CPR, while they're doing the pads on, assessing the rhythm and all those things. So continue CPR. You're not going to stop the CPR. As I showed you in the graph before, it's got more chances of survival.
Manju,
yeah.
What will happen if we do more than 30 compression?
Oh, okay. So let me clarify this. So what this means is you do 30 compression. If there's someone else to give breath, 2 breaths, back to 30 compression, 2 breaths. So your compression is going to be continued. So you're going to count loud. 1, 2, 3, 4, 5. Once you get to 30, then the person who's trying to do the breathe, they're going to give 2 breaths. And then you start again. 1, 2, 3. It's going to be cycle after cycle after cycle. Does that
if we miss out like 30 counts, and then if we do 40 just in case, it's not
as I said, it's a very matter of life and death, so it's okay, but the guideline just said that 30 is 2. Once you do 30, then you give 2 breaths, and then back to 30 compression, you do 2. I've seen this the CPR going on for half an hour, 45 minutes. So yeah, I just want to show you a quick video now, if that's okay. So I'm gonna stop share and share screen. All right, hopefully this works.
If you do not get a response,
can you hear me? Can you hear the video?
Yell for help.
Yes,
yep.
Next, tell a specific bystander to phone 911 or the emergency response number.
Okay, let me just start from the start.
First, assess the scene. Look around. Make sure the scene is safe. You can't help anyone if you become a victim too. If the scene is safe, check the person for a response. Tap or shake the victim on the shoulder and shout, "Are you okay?" If you do not get a response from the victim, yell for help. Next, tell a specific bystander to phone 911 or the emergency response number. Remove clothing out of the way of the victim's chest. Next,
can I just interrupt? Sorry, did it play from the start or not?
With your hand, draw a line from
it was fine
yeah,
for
it
me.
did.
the center of chest.
Okay.
Yeah, it was.
Place the heel of one hand on the lower half of the sternum or breastbone. Now, place your other hand over the first, interlacing your fingers for support. With your arms straight and your shoulders positioned over the victim's chest, push down on the victim's chest. For an adult, you will want to push down at least 2 inches or 5 centimeters. Now watch as I perform 30 deep compressions in 18 seconds or less. You want to be able to give at least 100 compressions in a minute. You may lift your hand slightly off the chest between compressions to allow for full chest recoil. Check your hand placement. Keep interruptions to a minimum. It helps to count out loud. Some say humming the tune to the 1980s pop tune "Stayin' Alive" is good for keeping the right tempo.
Okay. Now, so this video said the same thing. Interlocking, keeping your arms straight, and compression, giving from the shoulder, because you might hurt your elbow, because elbows doesn't have much effort to compress. Now, do you think compression is going to be easier? No.
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 No, you will be very exhausted by 2 minutes. So
True.
that's, yeah, it's very exhausting, especially if this person is big, then you're actually doing all of your effort compressing. By 2 minutes, you're going to be exhausted. And that's the reason, if you've got somebody who can swap around, you should do that, because Our main goal is to save this person, and you want to make sure this compression is effective. If you're compressing not hard enough, it's probably not going to be effective. So, all right. So what's different in children in CPR? 1 to 8 is considered as children. So you can just do 1 palm compression rather than this. You do 1 palm compression. From 8 to 12 is depending on the size of the children. You could do 2 or 1 depending on your judgment. What to do with the airway, head lift and chin lift, same as adults. Same ratio is 30:2, 30 compression, 2 breath. Infant resuscitation is a bit different. Use only 2 fingers to CPR. Position is same, just over the chest, just lower part of the chest. Compression just like that. And head, not head lift, because you want to keep the head in a neutral position because of the anatomical structure of the airway for the infant. Infant means up to 12 months old. 30:2 is the ratio. Pregnant women, what's different is you put the padding underneath the right hip. They've got big bellies. When they lie flat on their back, they're going to compress the bigger arteries, the abdominal arteries, and that's the reason you want to put padding underneath. Tilt a little bit towards left side, up to 30 degrees. It doesn't have to be like right, it doesn't have to be like, okay, 30 degrees, you're not going to measure or anything, it's just the estimate. And then you can do the compression same like adults. Any questions? No. It's a big topic, isn't it?
Yeah, I know. All good.
There's so much to take in. All right. Nixon asked me before about the consequences. What if it goes wrong? So what can happen with CPR? The compression too high, like up above the breastbone, may not be effective because we want to compress the heart. And where is the heart situated? Is this lower part of the chest. What happens when it's too low? Then you're probably compressing the abdomen, the stomach. And what can happen? The acid from the stomach can come reflux. And I've seen lots of ribs fracture and other injuries and stuff. But again, it's not going to come back to you because what you're trying to do is you're trying to help somebody save their life. It's not intentional at all. Okay, you are doing compression after compression after compression. So when do you think you should stop compression?
When you will see any sign of breathing.
That's right.
Ambulance arrive.
Yeah. And physically you're too exhausted, you just can't perform anymore. So those are the things. So the main takeaway for this session is wrong CPR is better than no CPR. Another important thing is uninterrupted CPR is essential. So you want to make sure that you just continue on CPR. You don't stop for this or that. You just continue on CPR. That gives the chances of survival. And any consequences is acceptable because the alternate is death. So any questions at all?
No, I'm fine.
Good. Can I ask you some questions now?
Yes.
So what is doctor's ABCD?
Danger.
Air.
Response.
Yeah.
Ask for help.
Yeah.
For something. Yeah.
And for help.
A for
airways, breathing.
airways.
B for breathing.
Spot on. Thank you. Oops. Where did I go? Yeah. So what is cardiac arrest? Is it another name for a heart attack? A blockage in the vessel supplying to the heart? A term used when the heart stops beating? or a dangerously fast heart rate?
The third one, a term used
A
when
term
the
used
heart
when the
stops
heart.
breathing.
That's right. So when you do actual compression, should it be 90 to 100 per minute, 100 per minute, 100 to 120 per minute, or 120 to 130 per minute?
120.
100 per minute.
100 to 120. Yeah. I mean, again, it doesn't matter. As long as it's more than 100, it's fine. Yeah. And I want, you can't physically do more than 130. It's going to be too exhausting for you anyway. So depth, what should
5 centimeter.
That's right.
5
Yeah.
centimeters, yeah.
Yeah. So just going to quickly do a scenario as well. So you're alone at your lunch break, and then you get ready to enter your elevator to go to the lunchroom, and you observe a middle-aged man standing near you, clutching his chest in pain and collapse. The man is now laying on the ground. What should you do?
Are we in the elevator or just outside the elevator?
In the elevator.
Oh no.
Do doctors ABCD?
Exactly. Doctor's ABCD goes everywhere. Doctor's ABCD. Yeah, you look for danger. You're in the elevator, quite small space. You probably want to drag that person outside, so you got more room and you're not actually in that suffocation.
And there will be other people around to ask for help.
That's right. Yeah, you check the response, ask for help, start, see if there's anything in the airway. And then check for breathing. Obviously, this person's not breathing, and start on CPR straight away. Hopefully by that time, ambulance will arrive and help save this person. Okay, so that is for my session today. I think that it's probably a bit big for some of you, but I hope you got something out of it.
Yes,
No, it was really good, helpful.
good.
Very informative.
It was good, Manju. Whenever we do in a hospital, we don't go that depth. We just said they come with the dummy, do that things, and they go away.
Yes.
But that was in detail information.
Oh, thank you.
Manju, as my feedback, it was very well prepared. You've explained the words that we were unfamiliar with and clarified it. You asked questions, involved the learners. You used a lot of visuals to explain the actions that was required for the CPR. So that was very well done. You spoke clearly and it was a good pace. What else? And you frequently ask questions for our checking understanding as well. And yeah, thank you.
Oh, thank you, Jabrida. So the CPR is this kind of session should be like face-to-face, to be honest, because you actually perform to see how things will go to correct your positioning and things like that. But unfortunately, over the internet, it's not that easy. Yeah.
It was nice. It's so good.
All right. Thank you so much, guys.
Well done, Manju. You make
Bye,
it.
Manju.
Thank you. Okay, I will stop share now and stop video as well.